All right, Proposition 8.
So moving on to Proposition 8, just a little bit of background, if we could go to the first slide there. Okay, so many of you are probably aware of this, but people that have kidney failure require either a kidney transplant or ongoing dialysis treatment in order to survive. Dialysis essentially mimics the functions or some of the functions of your kidneys to allow you to survive. And according to our estimates, roughly 80,000 people in the state receive dialysis treatment through chronic dialysis clinics each month. Chronic dialysis clinic is a certain type of license that these clinics can apply for and receive from the State Department of Public Health. And as you can see in this table, about 75% of these chronic dialysis clinics are operated by one of two private for-profit companies, DaVita and Fresenius. On the next slide, just a little bit more background about dialysis. Treatment for dialysis is paid for by a couple of different sources. The federal Medicare program pays for treatment for the majority of people on dialysis in the state. The big reason for that is that Congress passed a law decades ago that made it so that if you have kidney failure, you qualify for Medicare, even if you're not 65 or have another disability, which typically would be the requirement. Beyond Medicare, other major payers include the federal state Medi-Cal program, which, as I mentioned before, provides healthcare services to low-income Californians. But dialysis is also paid for by group and individual health insurance. So that's insurance that you might get through your employer or insurance that you might purchase on the individual market through Covered California, for example. And an important thing to keep in mind here is that on average, group and individual health insurers, so your employer health insurance or your Covered California health insurance, they typically pay dialysis clinics multiple times what government programs, Medicare and Medicaid, pay for dialysis treatment. On the next slide, just a little bit of information about the potential impact of the measure and what it would do. The main provision of the measure is that it would basically limit the revenues that dialysis clinics could bring in to 115% of certain costs related to direct treatment and quality improvement. So for example, if some clinics that were operated by an organization brought in more than revenues that were more than 115% of their treatment costs and their quality improvement costs, they would have to give back the difference to their payers. The measure specifies that the rebates only go to non-government payers, so Medicare and Medi-Cal would not ever receive a rebate, but your employer health insurer or the company that you purchase health insurance from could get a rebate. The fiscal impact of this measure is uncertain for two main reasons. Reason number one is it's going to depend on how the agencies that implement this measure would interpret the provisions. It's not totally clear what's included as a direct treatment cost and what isn't, and that's going to affect how much revenue the clinics can keep and how they then respond. And the second uncertainty is how would the clinics respond? Bottom line, this measure would reduce the profits of clinics, the for-profit clinics, and we expect that these clinics would respond in such a way as to keep as much of their profits as they can. But there's a couple of ways that that could happen. So depending on how the measure is interpreted and how the clinics respond, we estimate that this measure could have an overall impact on state and local governments ranging from net positive in the low tens of millions of dollars to net negative in the tens of millions of dollars. That's all the information I have.
Thank you. So in terms of endorsements, we have Democratic organizations in favor as well as Green Party organizations. In opposition, we have the Republican Party and the Libertarian Party and other GOP groups. In terms of support, we have labor unions, community organizations, disability rights organizations, NAACP of Greater Sacramento, CalPERS, In opposition, we have health organizations, veterans organizations, the National Kidney Foundation, hospital associations, physicians associations, etc. Support in terms of officials, we don't have any who have come out in support. In opposition, there are several individuals who are involved in healthcare. And there's no media endorsements, but there's media opposition from many newspapers across the state. And the funding, the yes side is highly funded, and it's mostly healthcare workers unions and electrical workers unions. And the no funding is from those organizations that are private providers of kidney dialysis, not surprising. And the bulk of the money is in opposition. Questions about Prop 8? Bueller? All right, we'll move along to Prop 10 then.